Okay, so we're on the first guideline, which is that the social story shares social information with the patient, reassuring quality. So we want to make sure that our goal, our focus is not on changing the child's behavior or making our own life easier. Because if we thinking from that vantage point, from that perspective, we are going to write a real directive kind of story, like this is what you have to do, this is what you have to do, this is what you have to do, rather than if we think about it from the child's perspective of what they might be missing, what cues they might be missing in a typical social situation. We're going to get, and you'll see on your handout, you have a lot of examples of social stories at the end that use the child's perspective and just provide the basic information that the child's going to need. So we're going to get into that in more detail in a minute. We try to determine what an event might look, feel, smell, or sound like, or how a concept may be perceived from the child's point of view. So we identify the concepts or skills related to the topic that's going to be the most relevant for the child, the thing that they're going to be able to latch onto to help them navigate through a situation. All right, guideline number 2 is a social story is a well-written story. It has an introduction that clearly identifies a topic, it has a body that adds detail, and it has a conclusion that reinforces and summarizes the information that you've presented in the story. Some of these stories are very short. We're going to get to the length later, but some of them are very short, 2-3 pages with single lines on the top. Some of them are extensive and are like newspaper articles. And anywhere in between, what you always have to make sure that you're introducing the topic and have a really good title, which we're going to get to later, all the details, and then the summary. So you want to identify the topic, describe, and then reinforce the most important concepts. So we want to clearly state the topic. So for example, if it's something, if a child has freakouts when they lose a toy, if I lose a toy, people can help. It's a great introduction. Sometimes you might have to get the child's attention first by saying, my name is Jody. Sometimes when I lose a toy, people can help. And then the body is going to list out the details. So we'll get to guideline 3. Guideline 3 is you're going to use your WH questions and make sure that they're all included in there. So who is in the story? Where does it take place? When is it going to happen? Maybe it happens once a week. Maybe this is something that happens every day. Maybe it's a one-time deal like a surgery or a relative coming to visit. You want to use as many details as you think the child can handle. So that's who, what, or who, when, and where. Then you're going to also want to make sure you have obviously what is going to happen and then how the events are going to sequence. And then the last question, which is most important, is why. And so a really important part of using WH questions is if you can't come up with a good reason why this thing happens, then you're going to want to look at the environment. I'll give you an example. She uses a great example. I'm going to read it to you. It says, one of my first social stories was developed for a kindergarten class to describe lining up at school. I sat a long time trying to figure out why it was so important to have children stand and walk in lines. Just a little desperate that I couldn't come up with the rationale. And then she says it's only been one time that she's been at a loss to figure out why. It was a story to describe a child's kindergarten routine. I couldn't make sense of the 8 adults and 7 locations that were to be a part of his daily schedule. What was I to write? Sometimes adults design overwhelming programs for innocent children. This is okay. In all good consciousness, she could not do that, and so she realized the problem was the environment and not the child. So you want to make sure that you are able to come up with a rationale for the stuff that we're asking them to do that makes sense and that meets their developmental needs too. Okay, so that's number 3. The 4th guideline